Okay, so good evening everyone, and in the series of today, so we will start with the cadaveric image discussion series, which will be useful for cracking NEET PG 2021. So this is the part 1 and we are going to discuss the part 1 series of cadaveric image discussion. Okay, so myself Dr. Monalisa, and I am in the field of teaching the students from last 7 years for various entrance examination, NEET PG and AFMC aspirant, and I have done my MD Anatomy from Armed Force Medical College, Pune. So I would also like to give you the general brief about the Plus subscription of the Unacademy platform. So if you are going to avail the opportunity or take the subscription of the Plus of NEET PG, you can avail the opportunity to view the daily live classes of all the 19 subjects, the live test and the quizzes. There is also format of structured courses if you want to clear INICT, FMG or the NEET PG entrance examination or UPSC. Unlimited access is given to all the live sessions, and also unlimited access is given by viewing the recorded session afterwards if you have missed out something important, and you can also have the PDF of the notes. So those who wish to join the Unacademy platform, they can use my code Dr. Lisa-YT for 10% discount on the Unacademy subscription. I would also like to give you the brief of the iconic subscription of the Unacademy platform, where there is merging of Unacademy and the Prep Ladder group. Okay, so there you can have the opportunity of seeing the live classes, batches, video lectures, the Q banks, live test and the quizzes, and rapid revision courses. Again, you can use my code Dr. Lisa-YT. What is the code? The code is Dr. Lisa-YT for 10% discount if you wish to take the Unacademy subscription. Okay, I would also like to give you the information about the daily T20 for the NEET PG 2022 aspirants and the daily T20 event for the NEET PG 2021 aspirants. So this is the free test series, and do become the part of this at 9 PM and that of 8 PM daily. So you can have the practice of all the test series for clearing this examination. Now I would also like to give you the detail of my upcoming free live session. So I am coming with my free live sessions which will be useful for you in cracking NEET PG 2021 examination, which will start from 14th December to 18th December continuously. Okay, so 14, 15, 16, 17 and 18 December in continuation, and you can, and the timing will be same from 7 to 9 PM. The timing will be same from 7 to 9 PM, and you have to avail the opportunity of viewing my free live class by using the referral code ANAT10. So you will use the code ANAT10, ANAT, ANAT10, and if you are using the code ANAT10, then only you can see the live classes. Okay, so if you want to view my live session, you have to use the code ANAT10, and I am coming in the month of December by with so many live free sessions, and I will update about the whole of this schedule on the next YouTube session, which I am going to take place day after tomorrow. So for today, I just want to give you the information that I am coming with the live NEET PG students previous year MCQ session revision from 14 to 18 December from 9 PM to from 7 PM to 9 PM. Use the code ANAT10 for viewing this free live session. So free live session 14th to 18th December 2020 from 7 PM to 9 PM will be the timing. So I am updating now only with this schedule, but whole of the schedule for the month of December I will update in my Saturday YouTube session. Okay, So now for today's session we are starting with the cadaveric image. So I will come up with the cadaveric image sessions, small sessions of 15 minutes, and I will include 2-3 cadaveric images and I will explain that image in detail, and this cadaveric image session on YouTube series will continue for the entire month of December. Okay, now please concentrate on this cadaveric image of the heart, which is showing the interior part of the heart and important arteries and also the important valves. Okay, so I would like to give you the details how to identify these structures. Okay, so the first thing is that you can identify by using this. As you can see here, this is the artery. So I am highlighting this artery in this image, this thick artery which you are seeing here. Okay, so I want you to identify this artery. Now this is right coronary artery. This artery is right coronary artery. Now right coronary artery will run down in the arterioventricular groove. It will run down in the arterioventricular groove and will reach the crux of the heart and the major part which it supplies. So right coronary artery, if you concentrate, it is mainly supplying the right ventricle. It is mainly supplying the right ventricle, but it also supplies the few parts of the left ventricle also. So it also supplies 25% to 30%, 25 to 30% of the left ventricle part of the heart also, but mainly it is supplying the right ventricle of the heart. Now I also want to show you the another small artery. As you can see, this is a branch from the right coronary artery going down. As you can see, this artery, and this is the SA nodal branch. Which branch is this? This is SA nodal branch. This is a branch from right coronary artery itself, and in 60% cases the right coronary artery supplies the SA node. So SA nodal branch, it is SA nodal branch. You can just use the term SA nodal branch, which is a branch from right coronary artery in 60% of the cases. Okay, so now coming to the next same diagram, but I would not like to write everything on the same image because you can confuse by that. Now see the important orifices which is seen here. So let me firstly complete the artery on this. So this is the opening which you are seeing is the aorta, and this is the aortic valves which you are seeing. So let me just highlight it. These are the aortic valves which you are seeing. Okay, these are. So what you can highlight here, what are these? These are aortic valves. Now aortic valves are one of the semilunar valve. This is one of the semilunar valve, and what you can appreciate in the diagram, it is having 3 cusps. It is having three cusps, so it has 3 cusps as you can see in the diagram. Okay, now close to it, as you can see here, so we have seen the details of this we have seen. This is the aortic valve which we have seen, and close to it we have got the another valve, that is pulmonary valve. Okay, so we can also see here, close to it we can see the pulmonary valves. So again I want to highlight that this is the another semilunar valve which is again trilaminar. So this is the parts which we are seeing. Okay, so this is pulmonary valve, and pulmonary valve is also trilaminar. It is one of the, it is also semilunar valve. It is one of the type of semilunar valve which is again having 3 cusps as shown in the diagram. 3 cusps as shown in the diagram. Okay, now moving on to the further discussion. So I also want to highlight, so we have already seen the right coronary artery now. So this was the right coronary artery which I have already highlighted, so I am not writing much detail because we have already discussed this. This is right coronary artery which we have seen, and this is one of the SA nodal branch which we have seen on the other side. So this is the ascending aorta, this is the cut section of the ascending aorta. Inside we can see the aortic valves, and we can see it is tricuspid. It's not tri, it is having 3 cusps as you can see here. Same way here, this is also having, the pulmonary valves is also having 3 cusps. So in short, can we write that this is pulmonary valve, this is aortic valve. Okay, we have already discussed. Now coming to the description of the left coronary artery. So see here, this is the left coronary artery, this part, this is the left coronary artery. Okay, this is the left coronary artery. Now left coronary artery is mainly supplying or giving blood to the left part of the heart, and approximately when it runs approximately 25 mm only, it divides into its two major branches, as you can see. Okay, so two major branches, one is going here, as you can see, this is the one branch, as you can see, and this is the other branch, two major branches. Okay, so it, after its origin from the aorta, ascending aorta, it divides into two major branches. As you can see, it is winding posteriorly here. So this branch is circumflex artery. This branch is circumflex artery, and the other branch which you are seeing here, which we'll see on the anterior aspect, this is the LAD artery. This is which artery? LAD artery. So what is the full form of LAD artery? LAD artery means left anterior descending artery, one of the most important artery to be involved with the emboli formation. Okay, thrombus and emboli formation is quite common, or the most commonly involved artery is the LAD artery. That is, what is the full form of LAD artery? The LAD artery is LAD. LAD artery means left anterior descending artery. Left anterior descending artery. LAD artery means left anterior descending artery, which is also called as anterior interventricular artery. It is also called as anterior interventricular artery, a very important branch of the left coronary artery. So with this, we have finished about the coronary arteries which was seen in this cadaveric image. I also want to give you the details of the right and the left atrioventricular orifice. So let me again move on to this diagram itself. So we have completed the labeling of all these parts. Now coming to the atrioventricular orifices. So see here, you can see this is containing two valves, and this is the mitral valve. This is mitral valve, which is bicuspid in nature. As you can see in the diagram, the mitral valve means it is a mitral valve is seen in the left atrioventricular orifice. Where we see the mitral valve is seen in left atrioventricular orifice. Left atrioventricular orifice is the location for the mitral valve, and it is bicuspid in nature. Okay, this is left atrioventricular orifice which you are seeing. Now moving on to, so okay, this is left atrioventricular orifice, and this is the right atrioventricular orifice, and the right atrioventricular orifice is guarded by tricuspids. Okay, tricuspid, so it is tricuspid. Okay, so this is tricuspid valve, and it is guarding right atrioventricular orifice. Right atrioventricular orifice. This is guarding right atrioventricular orifice. Okay, now I also want to show you the middle part. Can you see this part? In the middle, can you see this is the structure which is seen between these two orifices, and a fibrous structure is lying in the middle. What is this? Any guesses? Anyone can guess which structure which I am highlighting with blue color? What is this structure? So I want to mention each and every aspect which is seen in this cadaveric image. What is this structure? This structure is cardiac fibrous skeleton. This structure is cardiac fibrous skeleton. So the next point is that what is cardiac fibrous skeleton? So cardiac fibrous skeleton of the heart is made of connective tissues, and it anchors the valves. Okay, as we have seen that we have got valves inside the atrioventricular orifices, we have got semilunar valves. So it is forming a supporting network or anchoring part. It is anchoring the valves and influences the force exerted by them. The cardiac skeleton forms a separation between the atrium, between the atrial chamber and that of ventricular chamber. Okay. So these are the important structures which is visualized in this specimen, as we can see here. Now moving to the next, it's a part of cardiac fibrous skeleton, Ashutosh Gupta, good try. So I think various parts which can be seen in this cadaveric image has been detailed. Now moving on to the next image, okay. So I will come up with the series of cadaveric images in every day for YouTube session every week for the Thursday and Saturday, and the same timing will be 5:30 p.m. okay. So that's it also important. I will write that details also. Now see, this is the dissection image of the head and neck region, and these are the showing important muscles or mastications here. So let me highlight. So can you see this triangular fan shaped muscle which is fanning out over the temporal region? So which muscle is this? This is temporalis muscle. This is which muscle? This is temporalis muscle. Okay. This is temporalis muscle, and also the part of this mandible has been dissected out, and you can see here. So let me just use this. Okay. So here can you see this muscle which is going inside? As you can see, it is going inner aspect of the ramus of the mandible. So how we can identify? So I am talking about this bulk of the muscle, this bulk, okay. So if you want, I will highlight it also. Let me use a highlighter. Okay, I am talking about this bulk of the muscle. Okay, this whole bulk of the muscle, okay, only this. So which is seen as going in downward direction, and as you can see here, so how we are going to identify the muscle? So let me use black color. This is the ramus of the mandible. This part is the ramus of mandible. Okay, very easy to identify ramus of the mandible. So if you are knowing the structure which is inserting on the inner aspect of the ramus of the mandible, so this muscle will be, any guesses which muscle is this? Any guesses? Ashutosh? This muscle is medial pterygoid. Absolutely right, Rohit. Absolutely right. This is medial pterygoid muscle. Absolutely right. Yes. Now let's move on to the upper aspect. So I want to describe the other one. So see here, as you can see, I am describing this upper muscle. So this muscle actually two heads, this muscle is having two heads, and this whole muscle is going towards the TM joint. So which muscle is this? Lateral pterygoid muscle. And how we are going to identify lateral pterygoid muscle? Because in this diagram you can see it is going towards the TM joint, okay, TM joint. So also we can see the part of articular cartilage here. So let me use blue color. So can you see this small piece of cartilage which is shown in this diagram? This is the articular disc of TM joint. This is the articular disc of TM joint. This is the articular disc of TM joint. This is articular disc of which joint? TM joint. Articular disc of TM joint. And this opening which is seen here is external auditory meatus. This opening is external auditory meatus. External auditory meatus. Now other than that, if we want to see here lower down, this part of the muscle which is shown here on the lower aspect. So if I outline whole of this muscle, which is also, if you very nicely see, it is pierced by duct. This duct is here. Okay. We have already done the labeling of this muscle. So I just want to highlight this duct. So I have, can you see this duct? This is a duct. What duct is this? This is parotid duct. This is parotid duct. So the muscle which will be, so I am talking about this muscle, and let me just use a highlighter for this muscle. So I am talking about this muscle. So when you are knowing that it is pierced by parotid duct, so now it becomes easy for you to identify the muscle. Which muscle is this? I think most of you are now able to identify. Buccinator muscle, absolutely right, absolutely right. And yeah, So this part which you are seeing is the parotid duct. So now I should use another color for the parotid. Pierced by parotid duct, and the muscle is, the name of the muscle is buccinator muscle. Okay, this muscle is buccinator muscle. No doubt about this. And the muscle which is lying on the outer aspect of the ramus of the mandible. What bony part is this? This is condyle of the mandible, condylar process of the mandible. I am talking about this. Okay, so let us write C. So I am talking about this. This process is C. What is C stand for? C for the condyle of the mandible, and on the outer aspect of the ramus of the mandible, it is covered by another muscle. And what is the name of this muscle? Any guesses? Very easy. On outer aspect of the ramus of mandible, this structure. On outer aspect of the ramus of mandible, it is having which muscle? Masseter muscle. So this is masseter muscle. And also on the posterior aspect, another muscle belly is being seen, and to be more specific, this is posterior belly of digastric muscle. This is posterior belly of digastric muscle. So if you have an idea of all the structures and correlation of its origin, insertion, so it becomes easy for you to identify the muscle. So here we have already identified. So here we have already identified here the muscles. Okay. So this muscle we have already identified, and this muscle is the lateral pterygoid, lower to it is the medial pterygoid, the buccinator muscle, the masseter muscle. Okay. So I will come up with the series of cadaveric images, and the whole month of December, every session will be of 15 to 20 minutes, and I will come up with 2 or 3 important cadaveric images and will describe the cadaveric images. It will help you to crack the NEET PG entrance examination MCQs. Okay, now moving to the next. So before ending the session, I would also like to tell you that my free live classes series is coming up. Those who wish to see the class, please use the code. So you can use the code to unlock my free classes, that is ANAT10. ANAT10. Those who wish to see my classes free, they can use the code, that is ANAT10, and can see my free live sessions. Okay, my free live sessions will be taken, so I will give you the whole update of whole month of December. Actually 30 to 34 hours of free live session I will start in the month of December, so that it becomes easy for you to crack the NEET PG entrance examination. And this will be consist of all the MCQs being discussed of the previous 5 to 7 years, and it will help you to crack the exam. Along with it, I will also keep a session on cadaveric images, image based MCQs, and also clinical questions. Okay, the free live sessions will be starting from 14th December to 18th of December 2020, and the timing will be, so 2 hours series will be, one session will be of 2 hours, and the timing will be from 7 PM to 9 PM. And you can use the code, that is ANAT10, for seeing my free live session. If you want to become a part of my free live session, you can use the code, that is ANAT10. Okay. So before ending the session, I would also like to tell you that those who wish to see my sessions, so those who wish to take the subscription of Unacademy platform, they can use the code Dr. Lisa -YT for 10% discount on the Unacademy platform, and this is the Telegram group link of the Unacademy platform. Free live sessions can be viewed of all the educators, and also you can join my Telegram group where all the information about my upcoming session, YouTube sessions, has been discussed. So my Telegram group link is Monalisa Anatomy. Monalisa Anatomy. My Telegram group link is Monalisa Anatomy. So all the best, keep studying. This is the Dr. Lisa -YT is my code, which will be utilized by you if you want to join the Unacademy platform. This is the Telegram group link of the Unacademy NEET PG. All the best and keep studying. Thank you so much. All the best. Keep studying. Okay, again we will meet at Saturday for the YouTube session at the same timing, and special class session will be starting from the 14th of December. All the best at 7 p.m. Thank you so much.